So today we're going to talk about the most commonly asked questions here within our practice that the receptionist, dental assistants, Dr. Stewart and I get on a daily basis. So the first one is, what is SDF?
SDF is a material called silver diamine fluoride. It is commonly used to cover a cavity. The most common time that I use SDF is on a very, very young patient, a 2-year-old that has cavities on their front teeth. They're too young, too small to work on, so we apply the silver diamine fluoride on their front teeth. It's non-invasive. It doesn't hurt. It's just a little paintbrush and one-step process. So there's no shots, there's no drilling. So when the child has cavities at an early age, we place silver diamine fluoride or SDF on their teeth.
And the benefits?
The benefit is not having to go through an invasive procedure where they get shots and have to get drilled into.
Okay. Another one kind of related is sealants. What is a sealant?
A sealant is a protective coating that goes over the grooves of the teeth. Typically, we don't seal teeth until they have adult molars. And then with adult molars, which is about the age of 6 years old, we'll place sealants over their pits and grooves so that they don't get cavities as easily right in those locations. Once they get all their adult back teeth, that's when we'll place sealants on their second molars and premolars.
Do you have to redo sealants or get them more than once?
No, it's usually a one-time process. Sometimes they can come off, and if they do, we'll replace them.
Okay. So a lot of times we see kids with special needs or high anxiety or different conditions. If we here at Wabash Valley Children's Dentistry cannot meet the needs of those children, how can we help them get good dental care?
We usually refer to a office that has operating room procedures or operating room an anesthesiologist that can help them. So they'll be put under general anesthesia. And that's something we just don't do here. We prefer to refer that out to either a clinic or a hospital setting that has general anesthesia.
And here we do what kind of sedation?
We use nitrous oxide here in the office, which is a lighter sedation, not a deep sedation. Nitrous is very safe, commonly used with kids, and we use that just to keep the child a little bit more relaxed.
Okay. A lot of moms will ask us, why can you not complete treatment for the whole mouth in one visit?
If they ever want their whole mouth completed in one visit, that's when it's time to be put under asleep and go through general anesthesia. Here at Wabash Valley Children's Dentistry, we'll go quadrant at a time or one area at a time, specifically just to keep the procedure short. We don't want to keep them in the chair for too long. They're going to get antsy. They're going to get a little fidgety. So we'll keep it into a quadrant. We'll use the nitrous oxide. We'll place the topical anesthetic, which is a numbing jelly. And then we'll give a local anesthetic to make sure that they're comfortably numb and just work in that one area. So if they have multiple cavities in multiple areas, we're going to do it in sections at a time.
So it's just to kind of make it a more pleasant experience for the child.
And not be in the chair for too long.
Okay. Can you explain the difference? We get asked a lot, what is the difference between a root canal and a pulpotomy?
Baby teeth have big nerves, so they can get infected pretty easily, or they can get cavities that get close to them very easily, and that's called a pulpotomy. So that's when we go in and we clean out the nerve chamber, the big part of the nerve. A root canal is commonly done on adult teeth, and that goes the nerves all the way down the roots of the teeth. So a root canal is going to usually be done by an endodontist, which is a specialist that does root canals. A pulpotomy is usually done by a pediatric dentist that is going to place a crown over a tooth and has to clean the nerve of the tooth out, but not go all the way down the roots. And again, done on a primary tooth, a baby tooth, versus a root canal done on an adult tooth.
Okay, so Dr. Stewart can do the baby teeth pulpotomies here at our practice, but for adult teeth on children, we refer out to an endodontist.
We're going to refer to an endodontist.
Yeah. Yep. Okay, great. And then the last question we have for today is, what sets our office apart, in your opinion, from other dentistries?
I've always tried to say that we give personal care with a personal touch. You know, I'm the only dentist here, so you're going to see me and you're going to get to know me. I may be moving around a lot and I may be busy, but at least the parent and the child is going to visit me, and you're going to have one dentist and one dentist only that's going to be seeing their child. So you'll get to know me on a little bit personal level, and I'll always make sure I have time to talk to the parent, go through the procedures. The child gets to know me. Hey, I remember you. And now I'm even getting parents that bring their kids in and say, well, I was a patient here when I was a kid. So now I'm on generation 2 of patients.
Yeah, I think that's super fulfilling to see play out.
It sure is.
And I think that consistency, what you just mentioned, the child has that consistent experience of always seeing you.
Right. And they know who their dentist is.
Yeah. Thank you, Dr. Stewart, for answering all of our questions today.
You're welcome. We'll see you guys soon. Thank you.